Hi class, in this recording we are going to focus on the kidney, both the anatomy and the histology of the kidney. So let's dive into it. Within our urinary system we have kidneys that produce our urine. So here we can see the right kidney, here's the left kidney. Those right and left kidneys will produce urine and send them through the ureters to the urinary bladder. And from the urinary bladder, that urine will then leave the body through the urethra and exit our bodies. So as we look at the kidney in general, we are going to first focus on and just zoom in on that kidney. I'm going to go ahead and remove the skeletal system here and all the ligaments just to clean things up, and let's get rid of that muscular system too. I don't want any muscular systems. We have just the urinary system, a nice clean view of the urinary system. So we're looking at the kidney. The capsule is the outer layer of the kidney. I can go ahead and remove that capsule, the renal capsule, just to expose the kidney proper. And what we see here is there's an indentation. This indentation, give me a moment here, right there. That indentation where tubes go in and out of the kidney, that's referred to as the renal hilum. And to better visualize those tubes, I'm going to go ahead and add the circulatory systems. Now we can see there, associated with that renal hilum, there's a renal artery, and go ahead and click on that renal artery. There we go, a renal artery and a renal vein that will carry blood in and out of the kidney. Now, within the kidney, we have columns, cortexes, and medullas. So let's go ahead and look at that in more detail. Let's get rid of the cardiovascular system again, and we'll just go ahead and remove that anterior half. So within the kidney, we have the cortex as the renal cortex as the outer tissues of the kidney. The renal medulla is more difficult to highlight here in visible body, so I'll just use the breadcrumbs there to highlight the renal medulla. The renal medulla really, let's do multi-select here, is the renal pyramids and renal columns combined. Now if we look at the renal columns are going to be in between our renal pyramids. So here I have the renal columns highlighted. The renal columns from a histology perspective are very similar to the renal cortex. And sorry about that, I just paused my recording because I got a phone call from my wife. Where was I? Renal pyramids. So as we look at the renal pyramids, they're actually going to be more conical in shape, in three-dimensional shape. But if we look at an actual kidney photomicrograph, like what we have over here, the renal pyramids tend to be more triangular in shape. And actually, that's not a very good renal pyramid. So let's go down to, oh, that's terrible too. Let's go to digital histology. I really want to emphasize these renal pyramids for you. Boom, that's beautiful. There is our renal pyramid right there for you. Doesn't get much more beautiful than that. So even though they're triangular in a photomicrograph, they are actually going to be conical when you look at the three-dimensional shape of the renal pyramid. As we look at the cortex, the renal cortex, it's going to be this outer edge of the kidney, and then the renal columns are these tissues in between the renal pyramids. So that is the anatomy and histology of the kidney generally speaking. Let's pull up our lab objective sheet. We have a few more structures to cover. At the apex of every renal pyramid, we have a renal papilla. I initially learned this structure as apex of the renal pyramid. So if we zoom in here, right there, we have that apex, or the point of the renal pyramid, and that, or renal papilla, and that's going to drain urine. Let me go ahead and remove that adipose tissue. That'll drain urine into the minor calyces, and two or more minor calyces will merge to form the major calyces, and those major calyces are then going to drain urine into the renal pelvis. And then from the renal pelvis, the urine will travel through the ureter to the urinary bladder. So that's the major anatomy and histology of the kidney. If you have any questions or comments, please feel free to post them on the course discussion board or to shoot me an email. And as always, happy studies.